This video is going to be the analysis of the shoulder and elbow when throwing a pitch. So, the first starting position is with the body facing sideways and upright, feet shoulder width apart, arms brought out closely to the chest, bent, shoulder in neutral position, elbows in flexion for both arms. For the elbow joint, the elbow will be in flexion or slight neutral pronation. The biceps brachii, brachialis, brachioradialis work in concentric motion. The pronator teres, pronator quadratus work in concentric. And then the triceps work in passive eccentric. Supinator biceps work in eccentric. Then for the glenohumeral joint at the shoulder, there will be abduction of the humerus at the glenohumeral joint, external rotation of humerus at glenohumeral joint, horizontal abduction of humerus. The middle deltoid and supraspinatus aid in concentric, infraspinatus teres minor work in concentric, and the posterior deltoid infraspinatus work in eccentric. Then for the antagonists, the latissimus dorsi, teres major, pec major aid in lengthening. The subscapularis, pec major, latissimus dorsi work in eccentric, and then the pectoralis major passively lengthens. The end position is where the pitcher begins shifting their body forward. Weight shifts back onto the right leg, then lifts their leg towards their chest. The right shoulder moves into abduction with slight external rotation, then a little bit of horizontal abduction as the arm moves backward in the windup. The right elbow moves into greater flexion, setting up proper forearm position for the external rotation. This second phase is called the early cocking phase or the stride. Shoulder is abducted, elbow is flexed at 90 degrees, trunk is rotated slightly away from the target, and then the arm moves behind the body. For the shoulder joint, the movements will be external rotation of the humerus, abduction, and then scapular retraction and upward rotation. For the movers, the infraspinatus, teres minor, posterior deltoid all work in concentric motion. The deltoid supraspinatus aid in concentric motion, and then the rhomboids, middle trapezius, serratus anterior aid in stabilizing isometric movement. And then for the antagonists, the subscapularis, pectoralis major, latissimus dorsi are eccentrically stretched. Then the latissimus dorsi, teres major are lengthening, and the pectoralis minor is passively lengthening. For the second joint at the elbow is maintained in flexion, and there's high valgus load at elbow force. For the movers, the biceps brachialis work to stay in isometric motion, and then the flexor and pronator mass eccentric stabilizers. For the antagonists, the triceps stabilize ulnar collateral ligament, and that works in passive ligament restraint. For the end position of this phase, the shoulder reaches maximum external rotation, elbow is still flexed at 90 degrees, and the scapula is retracted and upwardly rotated while the trunk is rotated. For phase 3, this is called the late cocking phase. The start position is where the shoulder is rotating through external rotation, the elbow is still flexed at 90 degrees as well as the shoulder abduction at 90 degrees, and the trunk is rotating forward. For the shoulder joint, the movement is going to be internal rotation of the humerus, horizontal abduction, and then adduction of the humerus. For the movers, the subscapularis, pectoralis major, latissimus dorsi, and teres major work in concentric. The pectoralis major anterior deltoid work in concentric, and then the latissimus dorsi, pectoralis major work in concentric until near maximum external rotation, then passive structures like the ligaments assist. Then for the antagonists, the infraspinatus, teres minor, posterior deltoid work in eccentric control, the posterior deltoid rhomboids work in eccentric, and then the middle deltoid works in eccentric, then lengthen. For the elbow joint, the elbow is extended and there's forearm pronation. The movers will be the triceps brachii that works in concentric, and then the pronator teres and quadratus work in concentric to maintain the angle. Then the antagonists, biceps brachii, brachialis, work in eccentric near release, and the supinator, biceps brachii are lengthening. The end position of this movement is where the shoulder is still reaching maximum external rotation, the elbow is still flexed, the forearm supinated, and the body is fully rotated towards the target. The fourth and final phase of this movement is the deceleration or follow-through phase. The start position will be where the shoulder is at maximum external rotation and is abducted to 90 degrees. The elbow is still flexed and the forearm is supinated. For the first joint at the shoulder, the movements is where there's deceleration of internal rotation and control of horizontal adduction. The movers is internal rotators, subscapularis, pectoralis major, and latissimus dorsi are concentric power generators. And then the antagonists for the shoulder, external rotators like the infraspinatus, teres minor, are eccentrically lengthening to control rapid rotation. Then at the elbow joint, there is elbow extension, then flexion from the momentum, and there's valgus stabilizing. The movers is going to be the triceps brachii working in extension and pronator teres to work in concentric motion. Then the antagonist is going to be the elbow flexors like biceps brachii are eccentrically and supinators are eccentrically lengthening. The end position for this movement is where the ball has been released, allowing the shoulder to finish internally rotating and horizontally adducting. The elbow is still at full extension and the forearm at full extension after release. Now I'm going to show my brother going through his full pitching motion in slow-mo so you can see each phase in real time. This is the preparation wind-up phase, stride phase, late cocking phase, deceleration.